This conference will now be recorded.
History taking is very important. Actually, if you get a station in your OSCE which is asking you to take a relevant history and then go to management, you should know that you have a good chance of scoring very high. You have been taking history right from your med school, like from third year of medical school onwards, and then during your internship and during your residency, you have been taking history. Then the question can be asked that what is the difference between history taken by an undergrad and history taken by a postgrad? Like you are a postgraduate who has completed her residency. The difference is that now your history has a purpose. More so during examination, it is the history which is going to give insight into the condition of the patient, why she is here, what has happened, how has she been doing before, and how you are going to help her. History taking is a very important art, but unfortunately, if you will go over the exam reports, they show that candidates are not well prepared in this area. There are different reasons for it. So what I can suggest is that whenever you are going to take history, follow a sequence, and by doing that, you are not going to ignore any points. And then you should know that history taking is very important because it is going to guide you that what is your initial provisional diagnosis, what sort of investigations you should do, what should be on your list of examination, and it is important to reach a diagnosis, and then if you have a correct diagnosis, then you can manage the patient appropriately. So in preparation, what you can do that when you are standing outside the cubicle, read the OSCE scenario very carefully. What exactly they are asking, how much information has been given, and what questions you need to ask. And you will have a some impression, some idea also that what is this patient going through, what can be her complaint. Then you should know that when you enter the cubicle, you're going to see the examiner and the role player. And if you make a good impression, then you are going to do the rest of the station also in a good way. But if your history is not organized well, then you're going to make a poor impression, and it is you can become nervous and you can forget many things. So here there are many templates of taking history, and there are many different approaches, and you can choose any one which works for you. And actually, none of the specific patterns is important as long as you have taken the full history. That is the point. So when you're taking history in field of obstetrics and gynecology, you will have to ask about certain additional things. So we'll go over them also. So here is a general template for you. For the more templates and the other types of histories, we'll continue giving you some up to. You should enter the cubicle, introduce yourself, and then clarify your position. During exam, you can also say that I am Dr. So-and-so and I am here for the exam. Then confirm demographic info of the patient that you are Amal and you have this problem and you're 29 years old. Is that correct? She will say yes. Then you need to ask her that what brings you in here today. So what happened? Or you can say like, how can I help you today? So she's going to tell you something. At that time, you should clear the agenda with the patient. So you can say, Amal, you are having this bleeding. That's why you are here today. She will say yes. Then you can say, tell me a bit more about this bleeding. So that is called like you have done the introduction, and now you have introduced yourself, and you have taken introduction of the patient, and you are asking about the main concern. Then you need to ask her that what is the history of present illness, what is the history of presenting complaints. Like you should ask about the onset, frequency, course, and context of the events. If she has any pains, then you should say that tell me more about the pain. This is an open-ended question. She is going to tell you everything that she has been feeling. So actually when you are asking about pain, the patient should tell you about the location of pain, site, radiation, then duration, like the length of each episode of pain, character, that what sort of pain she is having. And you can ask her that how will you ratify your pain on a scale of 1 to 10? So you are going to use the pain scale. Then quality of pain. Is she having any functional impairment, aggravating or alleviating factors, related symptoms associated with the chief concern? Timing, like they occur at day or at night, on weekly basis, monthly basis, or like what? Then explore her ideas. That what is her personal opinion about this pain, feelings, or ideas of the concern, and then what she is expecting from this meeting today. Then you will go to the past medical history. You can start by asking that how is generally your health? Do you see your GP for any reasons? So she will tell you. Then in the past history, past medical history, you are going to ask her about any history of operations, any hospitalizations, any other illnesses, injuries, and is she on any medicines? If yes, that what is the dose, frequency, are these prescribed or these have been picked up over the counter? Is she taking any herbal preparations, vitamins or supplements? History of allergies and reactions, and don't forget to ask about the food allergy. That is very important. Allergy to medications. If she says yes, then ask what happens when you take this medicine. If she says that she will have just a mild rash, itching, and then it goes away, then you will say, okay, that's fine, it can happen. But if she tells you that, I couldn't breathe and I had to be shifted to the hospital, then you should know that this is anaphylaxis, and you must say that I'm going to write it down in your notes so that anybody whosoever will see, they will know that you are allergic and they will not prescribe it. Then ask about the environmental history, environmental allergies, like maybe she is asthmatic and having allergy to these pollen allergy or other types of histories. Then ask about immunization if relevant. So, like in cases of sickle cell disease, thalassemia patients, or other patient having some other immunocompromised state, you can guess that from the history. Then ask her about the screening tests. Like cervical smears, they are also a sort of screening. They are also screening. So ask her, are your smears up to date? Any history of abnormal smears? So then if she is in the older age group, ask her about mammography. If there is family history of cancers, ask about colonoscopy. So don't forget these important things. And if you're going to the OB/GYN history, you need to ask about menarche, menses, regularity, irregularity, last menstrual period, childbirth history, history of current pregnancy, that things have been fine so far, when did she book, where did she book, did she take any, supplements, folic acid, and how was the sugar control. And you should understand that it is important to ask about the answers which were negative. You have to mention all the negatives and the positives. This is a wrong concept that you should just mention the positive points. You should mention the positives and negatives. How pregnancy was diagnosed. Did she face any early pregnancy problems like bleeding, vomiting? At what time of gestation she booked herself? What routine investigations carried out, like the booking bloods, any screening tests? Has any scans been done so far? Like mostly you should ask about the dating scan. If she's like more than 20 weeks, then you need to ask about the anomaly scans. Were there any additional scans? Did she have to go for the take care assessment unit? How was the OGTT? Did she have to go to accident and emergency department because if she developed any problem? Ask about the history of childbirth, like how many children she has in a chronological order. Then, did she have any miscarriage? Did she go suffer any any ectopic pregnancy? Did she go for any termination of pregnancy? What was the diagnosis and what was the management? So then ask about the history of birth. Onset of labor, was it induced or spontaneous? What was the mode of delivery? If operative delivery was done, then why it was done? What was the birth weight, genders of the babies if she doesn't mind? Did she face any complications? Complications she could have faced in the antenatal period, intrapartum, in the postpartum period. Ask about the baby also. In ops, mostly, the doctors, they will ignore the baby. Ask about the mother and ask about the baby. Then what about breastfeeding? Was she able to do that? And was it okay? And for how long she continued? If you have time, baby is doing well, that's fine, okay? All of these things. So then you need to ask about the psychiatric history, that how has been your mood in the last 4 weeks. And the second screening question is that are you having as much fun as you were having like 4 weeks ago? If there is any change, then ask her about the ideas, that how you think, what would have triggered it? What could have triggered it? These are the points, okay? Then ask about any other healthcare providers that she has come across. Then go to the family history, like the parents are living, how is their health? If someone is dead, then ask that what was the cause of death. Maybe they developed like some clots on the leg veins, any other problem. If they died, then what was the age when they died? How was their health? Cause of death. Okay, these are the things. How are your siblings doing? How about your children? Are they okay? Then ask about hereditary diseases. That does anything run in the family? Like there can be allergies, there can be history of alcoholism, cancer, diabetes, heart disease, hypertension, mental health, and obesity. Then you should go and ask about the social history. Social history is very important. Like you should ask about the marital status, education, ethnicity if you cannot see, occupation, what do you do for a living, what is your functional status, what sort of life you are leading, what do you do any sort of physical activity, like are you exercising regularly? So then you should ask about any drugs, anything, how is her sleep pattern, what does she do for recreation, does she take a healthy diet, what are her hobbies if you have time, what do you do to relax yourself, any history of travel, overseas exposure, especially if the patient has like history of abdominal pains, or if the patient has diarrhea, or she has history of excessive vomiting, then you need to ask these questions. Ask her that how are things at home? Do you feel safe at home? So is the environment supportive for her? So that's how you can ask her that are you happy at home? Do you feel safe at home? These are simple ways of asking the questions. Then do you mind if I ask you certain questions like do you smoke any sort of drugs? Then if you have like a teenager, you should always ask about certain risk factors, like any history of social deprivation, any history of domestic violence. So again, the same question, that do you feel safe at home? Do you feel good at home? Then ask about the sexual history. Sometimes, when you have same-sex couples, so in that case, if you are seeing the name, so you should confirm it that you are like the in same-sex relationship, and you don't have to show your disapproval or anything. It is their life, right? And it is their choice, so we have no right to ask about it. Then ask about smoking. That is very important. And then at the same time, you should suggest that she should quit smoking because it is going to benefit her and her child in several ways. So that is very important. Ask them about any infections, any exposure, any violence, any exposure to the violence, any risk of any problems. And then in the end, you should always tell them that how they can prevent themselves. Like tell them about the seatbelt shoes, firearms, helmets, sunscreen, smoke alarms. These are the environmental safety points. You should mention them, these points. So once you have asked about each and everything, then you should look for the red flag signs in the history. What can be they? Like you can see many factors, like patient can have poor obstetric history, like history of preterm labor and delivery is very important, history of having children, babies which were small for dates, or history of having very very large babies, history of having any baby with fetal abnormalities, any stillbirths, any history of excessive abnormal bleeding during pregnancy. All of these things are important. Then ask about any pre-existing medical conditions, all of these things. Then, so, these points are important for you to remember. So these are the main points for you which you should remember. And then in the end, you should not forget to summarize. You're going to summarize everything for her. So you can say, you will address her by the name and you will say that, okay, I have asked you many questions, and what I have got from your history is that you are Amal and you are 34 and this is your fourth pregnancy and you have different problems and today you have come here with this complaint and so far the things have been fine in your pregnancy. So actually it should be a good history and things are linked properly and they are moving in the same direction. There should not be any conflicts. And at the end of this history, you should tell them that this information has been obtained, and then in the light of this history, we can proceed further, and we can you know request certain investigations. And now we need to examine you. Is there something which you would like to add up? That's all you're going to summarize. If the history has also already been given, then you are just going to summarize everything and you will ask her that is that correct? Is there something additional you would like to add here? She will say yes or no, and if she will say something, then you will say that it's a good point, let me add it to your notes. So conclude the history and then say thank you and tell her that if she remembers anything else, then she can volunteer that information to you. And then you will progress to the examination section. There can be like 15 different templates of history taking, but this is the more basic skeleton, and then you can build your history on this. If you want to know about more history taking, more histories like in field of fetal medicine, then how to deal with angry patients, how do you talk to a person who is a victim of domestic violence, or someone who has come to you for pre-pregnancy counseling, and then it's just like not very exhaustive. It is doable. Then you can listen to the other conversations and you can watch other videos in that series. Thank you very much, and I wish you all the best. Thank you.